Carrie Champine. I am an obstetrician and gynecologist, and I am located at Virginia Women's Health, which has 2 offices, one here in Blacksburg, and then we have one in Radford, and we are affiliated with LewisGale Hospital, Montgomery. Why am I passionate about being an OBGYN? I enjoy being able to allow women to understand their bodies and themselves. I really enjoy talking to the young girls, the 10 to 12-year-old population, about what's going to happen to their bodies and these changes that they're going to go through, which are exciting and scary all at the same time. I actually have a daughter who is 11 who gets quite embarrassed when I start to talk to her about this stuff. But I just think it's such a fun time, but it's such a time to make a good impression on these kids and to really help them understand their bodies and what's going on. I feel like we can really make a difference if we approach them early, not only with what changes are they going to go through and starting their period, but when they get older, talking to them about things like sexually transmitted infections and birth control and just relationships, just relationships with a partner and domestic violence and things that are oftentimes kind of pushed aside or we ignore because we think that it's not going on, but it is. I just think it's a very impressionable time. Kids want to learn. They soak up that knowledge. They soak up that information. They're a really fun group to work with. A lot of the pediatricians will provide a lot of the gynecologic care to young girls if needed, but we work in collaboration with them. If they have a tough case that they're not sure what to do, they might send the patient to see us, but a lot of times we just work together to figure out what the best option for girls are. As far as when to start seeing a gynecologist, you don't need to have your first annual examination till 21, but we encourage parents to bring girls at a much younger age, 16, 17, to start talking about these topics and, again, birth control and changes in the body and safe sex and that kind of stuff. So we encourage moms to bring girls at that younger age. And we tell them, we're not going to do an exam, we're going to talk. And you form that trusting relationship so that later, when it comes time for those exams, we have a good relationship and the patient is comfortable.